Hi, everybody. My name is Megan Asadian. I'm the outreach coordinator at the Rape Recovery Center. I use she, her pronouns. And today we are joined by Jim Struve, and we're going to be talking about male survivors. April is Sexual Assault Awareness Month. Our campaign for this month at the Rape Recovery Center is Our Voices, really spotlighting how to use our voices to end sexual violence in our communities and to feel empowered to talk about these issues and to spread awareness. And so Jim, I'll go ahead and let you do your introduction.
Good. Thanks, Megan. I'm so appreciative of the Rape Recovery Center being inclusive of male survivors this month. It's really valuable to get the word out more extensively. My name is Jim Struve, he, him pronouns. I'm currently executive director of Men Healing, which is a national organization that works with male survivors of sexual victimization. And just kind of really briefly about myself at a personal and professional level, I quite accidentally bumped into this work back in 1976. I got a job working with Child Protective Services with no kind of background or training in social work. And over the course of doing that and then working in a residential center for boys, was really working extensively with boys who had been sexually victimized, learned along the way that I was a survivor as well. And it was one of those kind of awarenesses that's been really useful over the years because I never forgot about my experience. It was just so pervasive and so normal that I never even considered that it wasn't normal. So, which is kind of a dynamic for a lot of men where male and victim are kind of oxymorons. It never fit together in my mind that was a possibility. It's just what happened.
Right.
And then the other part of it is that the invisibility. There was no services, and no one even knew what I was talking about. No one could really help. So I felt kind of stranded at the time. And what I did at that point in my life is I devoted that I wanted to change things so that no male had to be caught in that kind of vortex of invisibility. So now for 44 years, I've been working with male victimization in a variety of settings, and both personally and professionally stay incredibly committed to the social change, social justice aspect of the issue, and have learned through but lots of experience and my own healing how important the life changes are for men when you can get help.
Yeah, absolutely. Yeah, it's very important work that you're doing for sure. And just for those who aren't aware, what is like some maybe like baseline information in terms of like statistics or just generally any of that type of information about male survivors that you think folks should know about?
Well, a couple of things that are pretty common, pretty pervasive. One is the way in which male gender socialization allows males to be stoic, to be isolated, to be buried in whatever our pursuits are. And that's just being male. That's just the stereotype of males.
Right.
The double-edged sword of that is that allows many men to hide. It allows many men to keep their abuse invisible.
Right.
And what we found in our work doing recovery and healing weekends is we've been doing them now since 2001. We've done 77 weekend experiences with men. And what we found, and the research confirms exactly the data that we found, the average length of time for men when the abuse stops and when they first seek help is 20 years. That's a long, long lag time.
Yeah.
And I think what that speaks to is the oppression of invisibility. I call it oppression by deprivation. Where because you have no way of seeing yourself, no way of knowing what it is, we don't really have any sense that it happens across the board. In reality, 1 of every 6 men will experience sexual victimization.
Right.
That's not that vastly different than 1 of every 4 women.
Right.
But again, the gender stereotyping is we don't see it or don't consider it with the men.
Right.
Anybody who wants resources, our organization, menhealing.org, we've got an extensive set of questions and answers and information there. And we just released a video that's called Did You Know?
Right.
And the whole point of the 3-minute video is to show the vast array of images of who is a male survivor.
Yeah.
And the diversity of men. It can really be anybody, but with the statistic, most of you watching this video, you may be a survivor yourself. If you're not, you probably know somebody personally overlapping a job who is too, because 1 of every 6 men
Right.
overlaps with our support network somehow. And I think also the other issue is that mental health services are kind of crafted towards females.
Right.
Or the stereotype is men don't need to seek that kind of help. It would be destabilizing if men do it. And we really have to also find ways to make it more inclusive in all the agency outreach, that men can seek help too, and that things get better.
Yeah, absolutely. Definitely. When you said the oppression of invisibility, that felt really powerful to talk about. And it's something that I think even like at our agency, we try to navigate, like me personally doing outreach and education. How do we kind of go about this issue in a less gendered way?
Right.
And so that kind of leads to my next question.
Mhm.
Usually when we have these conversations
Mhm.
around sexual assault, they tend to be heavily gendered towards women, right? So
Mhm.
whenever I get questions about our services at Rape Recovery Center, people will ask, well, how many women do you see? And so it's very much so like gendered towards women, and neglects conversations around trans, non-binary, and
Right.
male survivors. And so how would you advise we kind of shift this conversation to be a little bit more inclusive? What do you think works, especially when we're talking about male survivors?
Well, I think as much as you can use language and images like a webinar like you're doing here
Mhm.
to make it clear to people that it exists, that it happens, because men will walk into places, or even in the media, we don't see images of males. Uh,
Right.
so therefore, it's out of sight, out of mind. We can't even put it together. We've had very few, we're getting more, but we had very few celebrities or high profile people who
Right.
have come out, unlike the Me Too movement, especially with the visibility that women are getting and
Right.
how pervasive it is. When you translate, 1 of every 6 males with the current population in the US means 27 million males.
Yeah.
That's not a small number. Those kind of realities make us stop and think, maybe
Mhm.
me. And then because it's not being talked about, like I said, with my experience, the kaleidoscope never clicked in that what I had was victim.
Right.
It just was. And
Right.
so until we have that awareness, a lot of men are walking around in some dissociated state about their own experience.
Right.
And I do find, although most rape recovery centers now are inclusive of males,
Mhm.
the messaging in the public is still that rape recovery centers are for females.
Oh, absolutely.
Uh, and there are very few organizations like ours that are trying to be visible for males. Um, it's very interesting how, with our weekend retreats, I
Mhm.
would say 90% or more of the men, when they first show up at a weekend,
Mhm.
I didn't know there were this many other men.
Yeah.
I thought this was just my experience.
Right.
And we have to extend that, because even with transgender, sexually diverse individuals, the
Mhm.
rates of victimization are higher,
Right.
because bullying, and then when you live in other forms of minority status, you
Mhm.
might be targeted, uh, your abuse stays invisible. And some of the stereotypes that we have, for example,
Mhm.
the stereotype is that if I say I was abused,
Right.
most people will think I'm saying I'm gay.
Right.
And so that's a very inhibiting factor for a
Right.
lot of people, because the associations
Mhm.
get made. And sexual victimization doesn't discriminate by gender or orientation.
Absolutely right. Super, super important to consider. And I think you kind of answered some of this, but I really want to delve more into this because I think it's so important. When you're like at the Rape Recovery Center, for
Mhm.
example, or like different like places that provide direct services for male survivors or want to provide more direct services for male survivors, what are some of the unique challenges that male survivors face? I know you mentioned a few, but
Mhm.
what are some things that direct service providers, victim advocates, therapists, clinicians should really be mindful of when they're working
Mhm.
with male survivors?
Well, I think it takes some intentional staff awareness and staff kind of witnessing. I think there's still probably a bit of it in the air. If a male walks in, the assumption is he might be a predator. If a male walks in, oh, maybe he's an offender.
Mm-hmm.
So there's kind of this shrinking that happens energetically about, do we want a man in the space with women? So
Mm-hmm.
I think we really have to be aware that we're messaging clearly there are non-offending male survivors.
Mm-hmm.
Because again, our imaging is that men who are abused become offenders.
Right.
And we have to really, most men do not become offenders.
Right.
However, most offenders are male.
Right.
So we have those two things, we got to separate them out. And that takes some intentional messaging.
Right.
Secondly, the messaging needs to be where we have images of males who are diverse,
Mm-hmm.
gay men,
Right.
transgender men. That imaging needs to be there because so many people say, I don't see myself. I
Mm-hmm.
don't know where it is. So then when the men walk in from their side of the equation, they can feel welcomed, they can feel included. Because I think a lot of men have felt like there's a need to try to educate the staff or push for services rather than walking in and saying, I'm home. These people get me. These people know me. So I think it's on both sides of the equation. I remember I was for a number of years doing male survivor groups at the Rape Recovery Center.
Right.
And from the beginning to when we got into it, the atmosphere changed amazingly.
Right.
And the men coming in would be so welcomed by the women. The women there would be so glad to see the men getting help.
Oh, wow,
The
yeah.
men were so proud that they had a place to come. The
Mm-hmm.
women were so proud to be sharing the space. And it wasn't taking away from anybody, but the expansion of inclusion.
Mm-hmm.
And we had such a range of diversity of gay men, straight men, trans men, old men, young men. Uh,
Mm-hmm.
Once that gets moving in an agency or a community,
Mm-hmm.
um, that really begins to change. And I know in Salt Lake City, where we're both based, because we're doing so much work on this, we have one of the more active male survivor communities in the country.
Oh,
Uh,
wow, yeah.
Unusual because there's so many people here being visible that we've created an environment that more men begin to feel like they can come forward.
Yeah.
So we're kind of known in other places as one of the um, groundswells of male survivors.
Yeah, that's really, really cool. And it's something that I know, like, especially in outreach, we're trying to kind of work towards in our own messaging and things like that. And while there's some pushback, I think, like, for the most part, one thing that I did notice is when we go into, like, I'm gonna like use high schools as a specific
Hmm.
example. We do a lot of like education workshops in the high schools as part of our outreach. And one thing that we try to be a little bit more mindful of is just like being more inclusive in our messaging, trying to be mindful of what pronouns we're using and things
Hmm.
like that, really including like statistics of male survivors and kind of talking
Hmm.
about that impact as well as a little bit of gender socialization.
Hmm.
And when we started making that shift, we actually noticed like more boys and men in these workshops
Right,
participating. Whereas like before, a lot of what we noticed was like it tended to be girls and women who would kind of speak up a
right,
little bit more, right?
right.
They would see like Rape Recovery Center, Sexual Violence 101, and they would say, okay, this is like my issue, right?
Right,
And the boys and men would be like, this isn't my issue.
right.
But when we started being a little bit more inclusive, we saw more of that engagement. And even from like
Yes.
a young age, that's so important. And it's something that like we're constantly trying to do. And there are
Hmm.
some definite challenges. I think there's still um, like this ongoing shift that needs to happen in terms of
Yes.
awareness and you know, debunking certain rape myths
Hmm.
associated with male survivors specifically. But yeah, a lot of really valuable information and insight. What resources, I know you mentioned a few, but what resources would you recommend for folks who are curious about learning more? Maybe they work in this field, but they haven't worked with a lot of male survivors. What resources would you recommend for them?
I think probably at this point in time, one of the best places to start with is going on the internet
Mm-hmm.
and perhaps accessing. There's several organizations that are doing work. I know Men Healing.
Yeah.
We have videos on our website of men talking about their healing journeys that are very powerful. We have this current Did You Know video. We have Q&A, list of resources for professionals, resources for survivors. Another organization, 1 in 6, is offering services, malesurvivor.org. So there's a number of organizations, and then that allows you to begin to fan out to do it. One video that I encourage people to watch that's really powerful, it was on YouTube a while back. It's called Sexual Assault of Males Played for Laughs. Sexual assault of males played for laughs. What it really exposes the way in which it's right in our midst, and part of the difficulty is the way in which we laugh at jokes about kind of slapstick jokes about men who might be victimized, or the whole thing about prison rape and showers and soap in the showers. So it's really kind of exposes the underbelly of things. So therefore, in our individual lives, when we're hearing jokes, when we're hearing things, how do we step forward? Another thing is to consider even just saying to men in your life, I just saw this webinar, whatever, do you know anybody who's a male survivor? They may say, yes, me, or they may say, yeah, I know somebody, but just the general conversation, getting it going. If you go on and do a search for movies, there's more and more movies and some imagery that are happening. One a few years ago was the Perks of Being a Wildflower. The Kite Runner is one about that.
I've read both of those books, yeah.
The Mysterious Skin is another one. But you then begin to find that there are more things out there in the media that you can do it. And if you begin to do Facebook searching and stuff, some of the celebrities or higher profile people are beginning to come out and tell their stories.
Right, yeah.
You can access that.
Yeah, cool. Those are all really great resources. I guess just to kind of like end this Q&A, what message do you have for male survivors during this time?
Well, I think one of the difficulties currently is because males are so prone to isolation. There's kind of like two ends of the bookend here. We can isolate so easily right now. And I really challenge everybody to reconfigure. The current messaging is social distancing. And I think what we need to be really aware of is it's physical distancing. Physical distancing does not require social distancing. Okay, it just means physical space. But therefore, we need to work in intentional ways to reach out to people. So use Zoom, use the internet, make phone calls, find a way to stay connected. This might be a great time if you are a male survivor to do more checking on the internet with these resources. Find out you're not alone. More groups like ours are considering beginning to offer some online support groups, things like that. And then the other end of the bookend is, as men who can get away with isolating, now we're stuck at home perhaps with people where we can't isolate because we're so close. So we maybe have to talk more about that experience of not fleeing, not running away. Partners and allies maybe need to be attentive to the cues that come when someone's you can't get away with hiding it quite as much. So engage people and talk with people. I think those are the most important messages, to just find ways not to socially isolate, but to physically isolate. And what I hear so often from men is that they're surprised when they disclose to somebody else, can I tell you about my experience? How often people say the response they get is, wow, that happened to me too.
Oh, wow,
or that was me too. Men continue to be surprised by the frequency when their disclosure prompts someone else to say, I've never felt okay to talk about it before. Thank you for opening that door.
Yeah, wow. This is really great. Thank you so much. We are very much so looking forward to posting this. This is really great, valuable information. But thank you so much. I really appreciate you taking the time out to provide this information.